The Honourable Member for Kabwum.
Mr. Speaker, good morning, fellow leaders. Mila totolong problem long how sick. Asking me, Mr. Minister, asking me, Mr. Speaker, and Bagolo say Minister of Health. This is in regard to Angau Hospital. Angau am stop inside long, late city, where me housing international community planted population of Papua New Guinea stop long and them look out him. Last asking me, Minister, where you are aware, awesome. Yes, almost 2 weeks ago, one blood time an incident where blackout may come up, na 7 plamanda. Minister, you are aware of this law or not? Suppose this law me resort power blackout, me like Minister Blong, power 2 must clear this law. And ask him too must go long and too long and must clear him why reason why suppose no got adequate power supply go long sla house we on around him scan on around him all city scans or one him all power me require him long and run him all machines that's la tai come up. Is it for the reason that power me suppose blackout na this like come up? Okay, then suppose you got standby generator, why at the same time generator off? Mr. Minister, suppose there's a problem inside Lonsla PHA, Morobe, in a bayou talking people from Morobe and people from Papua New Guinea. Why? One mass, not that generator wasn't working on that day, the very day. Suppose Lonsla die come up because of Nogat Marasin. Minister, you find out now you're talking Mibla. Why not? Suddenly, 7 people dead on the same day. Not two. I think Cube this last scheme, me too, Kolong, or Arab member last scheme, or PHA, suppose no manage him, or medical supplies, or Marasin Blomibla, or rural areas. We plan demand to die along, or districts Blomibla in Salong, Morobe, where no God man is away at the number. Minister, suppose come up attention, blue or no God. You working one and Sunday, long address him this heavy. Thank you, Mr. Speaker.
The Honourable Minister for Health.
Thank you, Minister. Sorry, thank you, the Deputy Speaker. Nami, thank you all leaders way. Oglo ask him a question regard to health long country blow yemi. And me saw him also me put him health priority. Lo way me stop long and that is thank you through this bar. Thank you. Question blow you the member for Kabwum. Thank you looks like ask him because I was like question related to Morobe province, Maki Mouse. Lord the Department of Health staff, lo country, me salim again, big talk sorry, blue me go leader man, Governor way Dina Luciumi, the Honourable later, Luther Wenge, me talk sorry, blue me go, lol. Suppose question blue me to talk side of funding lo PHAs. Firstly, me make a comment today to put on record, government today as of 22nd of October. From the operational funds, the government made allocated 569 million kinal operational funds, local the PHAs this year. To date, released 347 million. That's above 58% local funding released to date to PHAs. From Morobe province, PHA only gives them about 68% of funding blow. Out of all PHAs, Morobe province gives him 68%. So side of funding, as well as funding. Medical supplies, according to records, last 2 weeks ago, all supplies logo long Angau, na Morobe, PHA, ekota companies the last 2 weeks. So I'm depend now, all all health facilities, primary healthcare, kiss him, put him water blow go supply transit store, na kiss supply blow go have. Him looks also they were he got the area medical store blow Angau the lay been burned last year. Fire cook him last year, na government allocated him 20 million kina this year, lo rebuild him this la nobla area medical store. Today them released 15 million kina release go finish. Tender pro is now on, and I appeal to the NPC team. It's very slow. Can they fast track the NPC requirement and process so that this project or area medical store must fast track na complete money go finish. Na project go all. Na the Department of Health keep money stop now waiting process to go through. All this, me relate to go along having a good storage facility in place, na kisamarsin come in time na make it also. Some information I'm like just sharing with today. Kami lo point lo power supply as outage lo Angau Hospital mixing report lo CEO lo happen to lo a big concern on the 18th of October lo up 9 p.m. lo afternoon 9 p.m. lo night na power emi come lo 5 p.m. lo Sunday lo afternoon. I'm close to also 20 hours power blackout lousy. A big lousy you got power blackout. Even 3 minutes lo power blackout lousy can big problem. Even 1 minute. And 1 minute too long, housing power blackout is a serious problem. Now this time 20 hours. 9 p.m.
Honorable Minister, we have a point of order.
Mi hari minister sanat na totok na. Narpla minister responsible lo power sinan lo hapna. You know, we have a serious issue in lay, but there's a problem em totok long em we work to one kind. Oga the province marang to one kind. And the government is complaining. The minister should be telling us what the solutions are.
That's right, not complaining.
Not complaining. No, it's not an answer. The people want answers. He's not answering, Mr. Speaker. He's complaining.
Correct, he's complaining.
Honorable Governor for
He's
speaking.
complaining.
I
It's
think the
not
minister
clear
is
solution.
now on the question to answer, so I'll allow the minister to continue. Honorable
Thank you.
Minister.
I'm just stating the fact what has happened. I'm just stating the fact what has actually happened because member Bloim asked him, you got power blackout lo hap na, you got the line die. Also, I talk clear also yes, you got power blackout. Na report come also 20 hours straight power blackout na. One bla standby generator blow supposed to kick in area, even have been walked to. So we have actually established all these facts now that equal management now you got board staff long, make sure that all these things are happening. I'm just presenting the report that actually happened on this particular date, on the 18th to 19th. Actually, we do not agree. We condemn these particular arrangements, and each of the PHs they are responsible. PHs are responsible. They've given money. They're supposed to make sure that there's a standby every time system in place.
Tupla generator bagarap because blackout over 3 days. Standby generators for any of you that have been to school are not supposed to run for 24 hours. Or supposed to cut in, now only work 8 hours, now only go off. We are going to.
Honorable Governor.
No, me like him nipla yet. Me like him octary power. I come now.
Honorable Governor.
I'm sick of PNG power.
Honorable Governor, I resume your seat. Your point of order, out of order. The Honorable Minister, you continue on your. I cannot allow for you to debate on the question that is being answered. This is question time. So I'll allow the Minister to.
Thank you very much, Deputy Speaker. Yeah. Yes, the result, the reason for the blackout, I'm affecting generator blow housing. Generator blow housing now, generator in open. I'll get some issue long and I'll try and best to straight him. That actually that number of hours resulted in yes we can talk clear. Remember I talk law of 7 blood die, but they got report the camera CEO lo up to close 5 blood die. You got 5 blood die come up. 1 blood die die time only work long, only wait long emergency department. Somebody was rushed to emergency department during the time when there was a blackout, so unfortunately I lose a life blame. Now you got 4 blood where they were expected deaths. Even some prognosis long all and poor and they were actually waiting to die. I'm also sorry, Rosla. You got some line where prognosis poor.
We have a point of order.
Can the good Health Minister withdraw that statement? You don't pass prognosis on patients and you don't sort of pass a verdict on their life. It's totally wrong. You are not God to pass their judgment. So can you withdraw the statement, please?
Honourable Member, your point of order is in order. Honourable Minister, you can stress on your reply. Thank you.
Thank you, Deputy Speaker. Just want to say that there were 5 deaths, and during that particular period where power blackout, you got 5 that die come up. Now, people are sorry, Igolo slightly come up. That's what we're doing now is yes, I'm an unfortunate situation of power blackout law in Angau Hospital. Angau Housing kami big housing in Salo City. Na emi support him to stop ali the Morobe PHA. Na emi stop also 10 by districts in Salo Morobe. 10 by districts. Population blow laborism close to also 1 million. That's a lot. And many of the deliveries will come long Angau Dasol. One can also mention here. Okatol mama la kare okatol PMJ na stop. So if you look him, Angau is actually stressed out in trying their best to look after many of the cancer patients are now going to Angau at the moment because of reopening of cancer facility. You got 800 line go now along cancer facility in Angau as I speak today after reopening. That's actually saving themselves a lot of money. So apart from looking at the cancer patients, they are also forced to look after every others. A report comes only got to 100, close to 200,000 line only colong emergency department now outpatient last year. That's a lot. That's a lot. So if come back now, long small PHA team long ablo organize small system long na. Steady ma the Morobe PHA luduk law how they gonna reorganize the health delivery primary health care long Angau within the lay city. The way forward blame me. Way forward blame me is me call upon our landlord. The business sectors lo lay please I appeal to them. Today they have a business rep on the PHA board to come in where they are because then by taking 3 or 4 weeks, look see the part stand by generate the blood long Angau Hospital. That's coming overseas. They will need to fix that by taking 3 or 4 weeks. So when they are doing this, I'm always spending close to some 5,000 liters of fuel every 24 hours. And that's a lot of money. Now me appeal go long online law lay suppose all business houses they can come forward and support Angau during this period of this time of stress to come in. Only you see money blow, but suppose you got some way where business line can come in or anyone come in, and me like appeal to the Minister for Health. Angau need him assistance. Angau also at the moment they need our support. They need our support. We need to come in and support where we can. They're trying their best. Government give money, but that's where we are. That's the situation in Angau. It will need about 3 more weeks.
Honourable Minister, we have a point of order.
Thank you, Mr. Speaker. The good Minister has just been providing a rambling response to very, very simple and serious questions raised by both the Governor and the member for Kabwum. Can he just confirm how much money he's received from the budget and why is he saying that they're trying their best, your best is simply not good enough? How much money has he received to say that they still need all the help they can get from business sector? Thank you, Mr. Speaker.
Honourable Member, I've listened to your point of order, but point of order is like you asking a new question in a point of order. So I think the Minister have taken note of what you said. I'll allow him to finish up his reply. Minister.
Thank you, Deputy Speaker. The CEO is actually doing a recruitment of up to 500 more staff into the Morobe PHA as I speak. And the government committed 233 million kina this year. We will see an increase of 7,000 workforce into the PHA system. Morobe PHA is recruiting another 500 to actually support them as well. But again, the way forward, which I've recommended in the department, is there will be we want to see a system where Morobe, begat PHA belong separate lo Angau Housing. A minimal Port Moresby Hospital operating by itself, they have their own board, they have their own management team because some big set up to us. By arrangement where Morobe PHA operate outside of Angau Hospital. These are some of our points that we're considering at the moment so that there's additional resources for health coming to Morobe province. And some of the things we long at the moment, but we talk thank you long Australia. As we know that the government of Australia committed so much funds to upgrading the current Angau Hospital. But again, coming to the point, we will, Department of Health, fully supporting Angau the situation is at the moment. We have given them support and we'll continue to stand by them to make sure that we resolve this power issue as soon as possible. Thank you, Mr. Speaker.